Good afternoon, everyone. I'm really delighted to have you join us today in this Facebook Live presentation. This will be recorded, and you will be able to see this later if you so desire. So our talk tonight is going to be about kids and COVID-19 vaccines and boosters. And we have really a wonderful panel assembled here, and we really want parents to be aware of all about these vaccines, about their safety, about how to use them. And we want to give you a chance to get your questions answered. So I'm going to start by introducing our panelists. I'll start with Dr. Pat Whitley Williams, who's a pediatric infectious disease physician in New Brunswick, and she'll tell you a little about herself.
Thank you very much, Meg. Good afternoon, everyone. I'm Pat Whitley Williams, and I'm a pediatric infectious disease specialist. I'm a professor of pediatrics at Rutgers Robert Wood Johnson Medical School, also chief of the pediatric infectious disease division, and I'm just delighted to be here. So thank you for having me.
Thanks for being here. And now Dr. Sanjay Shaw is a hospitalist at Monmouth Medical Center. Can you tell us something about yourself?
Sure. Thank you for inviting me to this panel, Dr. Fisher. My name is Sanjay Shaw. I'm one of the pediatric hospitalists at Monmouth Medical Center. So I help to take care of children when they're sick enough to be in the hospital. But more important than any of that is I'm a mom to two beautiful young children, and I'm delighted to be here. So thank you.
Thanks, and we're delighted to have you. And then Dr. Anut Feingold from Camden and Cooper University Medical Center. Tell us about yourself.
Hi, I'm Dr. Feingold. I'm one of the pediatric infectious disease physicians at Cooper, and we help take care of sick kids in southern New Jersey. So we work both in the hospital and in the clinic as well.
Thanks so much. And the other person we have on our panel is Andrea MartinezMejia, and she's from the Department of Health. Andrea, tell us a little about yourself.
Hi, good afternoon. I'm Andrea MartinezMejia. I'm the Chief of Staff for the Department of Health, and along with Dr. Matt Fisher, we've been here working very diligently for the past 2 years on addressing the pandemic and making sure that we keep the public informed and we give the most up-to-date information, and we help vaccinate as many people as we can and to help win the battle against COVID. And as Dr. Shaw said, more importantly, I'm a mother of a 4-year-old.
Fantastic. And you speak perfect Spanish, so that if we are in need of any translation, we have our translator here as well. So Dr. Whitley Williams, let me start with you. How safe are these vaccines for children?
So the COVID-19 vaccines, Meg, are very, very safe. I want to underline that. How do I know that? Well, I've been following children with COVID and children exposed to COVID, and then with the development and introduction of the COVID-19 vaccines, I have firsthand knowledge and have witnessed hundreds of children having received the vaccination. And in fact, at our center, we were involved in the actual vaccine clinical trials. So I can tell you firsthand, these vaccines are safe. And I think everybody has to realize that there are millions and millions of doses of the COVID-19 vaccines that have been administered to date in children between 5 and 18 years of age. Now, there may be some common side effects, sure. Yes, many of the children do have maybe some slight headache in the older children. They certainly may have soreness at the site of the injection, a little swelling, a little heat. Sometimes there's a little redness. They may have soreness. And they may have a little fatigue within the first 24 or 48 hours, but these vaccines are tremendously tolerated. And I would like to say that I'm also a member of the Vaccine Advisory Safety Group that reports to the Advisory Committee on Immunization Practices. So that's the ACIP. That's the committee that makes the recommendations to the director of the Centers for Disease Control when these vaccines are ready to be recommended for the public. So I can tell you we meet almost weekly. I also want to assure the public that there are several mechanisms to monitor the safety of these vaccines, and that's ongoing. And many of you who have received the vaccine know that you are signed up for VSafe on your cell phones. And you get called or you get contacted, text every day for the first couple of days, then every week, and it keeps going. So we are really monitoring the safety of these vaccines. Are there some very rare side effects? Yes, there are. And I mention those because maybe the public has heard of them. And one of them is myocarditis. But it is extremely, extremely rare. I want the public to know that, in spite of millions and millions of doses that have been administered. So thank you for that question. I want to reassure the public, these vaccines are safe.
Thanks. Now, I know for adults, there's a choice of Moderna, Pfizer, or the Janssen vaccine, J&J vaccine. But for children, the only one currently authorized is the Pfizer, correct?
That is correct. And thank you for making that point. Absolutely. Down to age 5, right? So anybody 5 years of age and older is eligible for the COVID-19 vaccine, the Pfizer vaccine.
So some people may have heard of those side effects of J&J. Those are not going to apply to children because children aren't being given that vaccine. Dr. Feingold, oh, sorry, didn't mean to interrupt. Dr. Feingold, how worried should I be about this rare side effect of myocarditis? How worried should I be for my children?
I think we have, anytime we give a vaccine to a child, and any parent who makes the decision to vaccinate a child, they're of course going to be concerned about potential side effects. And we recognize that, and that's what part of being a parent is. But what we know about this extremely rare occurrence of myocarditis, which seems to occur primarily in the older males, adolescent males, is that these, even in the rare cases, these kids do very, very well. It's really a very mild myocarditis, not sort of some of what people might worry about. They're often hospitalized for a very short time, but even with drugs as benign as ibuprofen, they turn around and are, usually home right away. So it's clear that the risk of heart involvement in acute COVID infection or with multi-system inflammatory disease following COVID, that those patients have a much higher risk of true heart damage and severe symptoms. So in a way, getting the vaccine is actually a way of protecting your child against cardiac involvement with this virus.
Thanks. I think that's an important way to look at it. Dr. Shaw, can you tell us a little bit more about that multi-system inflammatory syndrome?
Sure. So scientists are still researching why some children get this after COVID and why some don't, and why some children are very, very sick with it and some are not. So that is an area of ongoing study currently. But the thought right now is that a child acquires COVID-19 infection, may or may not have mild symptoms, but then sometime in the time frame of 2 to 6 weeks after being sick from COVID, their immune system goes into this hyperimmune state where inflammation and swelling starts to happen throughout the body. You might see that in your child as pink eye with the eyes looking red. The mucous membranes like the lips or the tongue might start to get dry, cracked red. A child might start complaining that their heart or their chest is hurting or it's difficult to breathe due to the inflammation around the heart that Dr. Feingold was describing. A lot of children are presenting with belly pain or diarrhea, and almost all children are presenting with fevers as a sign of all this ongoing inflammation. So like Dr. Feingold said, this is multi-system involvement. It's an immune response that happens sometime after having COVID, usually 2 to 6 weeks after. And it is serious. So children do need to be hospitalized and treated in order to recover from the condition.
And what do they get treated with, and how well do they do?
So thankfully, we have seen now the data from the first round of COVID, and as we start to see more and more children having this MIS-C, especially after having COVID during the holidays, children do get better. Most of the time, any of the acute inflammation or the ongoing inflammation that we see at the time that they get sick is better by 3 months of recovering from MIS-C, but they are treated with different medicines to help relieve some of that inflammation. So aspirin for the heart, a solution called IVIG, which is a high dose of immunoglobulins to help decrease some of that inflammation in the body, and other treatments as needed based on how the child presents.
So it sounds like it's sort of the inflammatory system going berserk, and your treatment is to calm it back down.
That's exactly right.
And the good news is that most children do well, but obviously it's something we'd love to avoid. And we know that if you never get COVID, you can't get MIS-C.
That's true.
Terrific. Well, Dr. Whitley Williams, a lot of times we hear, oh man, these vaccines just came out too quickly. You know, do we know if they were really tested for side effects, and how did that go for them to get authorized?
We get that question often. And I know it appeared that these vaccines came forward very quickly, but the truth is that the messenger RNAs vaccines and the adenoviral vector vaccine, which is the similar to the J&J vaccine, and the messenger RNAs are the Pfizer and the Moderna. These vaccines, the processing of them had been in development for years. So that's why it was the companies were able to take these vaccines that had been developed and quickly use them to make the COVID-19 vaccine. So the technology was there and had been developed. And that was very useful because we were in the middle of a pandemic with people dying and people being hospitalized, et cetera. So, and then I think everybody should be aware that these vaccines go through a very strict process. And that is, they go through what they call clinical trials. There are 3 phases. And they start out with phase 1, which has anywhere from 30 to 100 people. And they're really looking to see what dose should be used. Is it safe? The second one, the second phase clinical trial has more. It has like 300 to 500 people. And there it's really looking at, again, safety. And again, how effective is the vaccine? And then the phase 3 trials are much larger. They're in the thousands. And here they look again at the vaccine, how effective is the vaccine, how safe it is. Are there other side effects that may not have been seen with a smaller group of study participants, and the dosing, and to make sure that the dosing is appropriate. So I think it's important that people understand that all of these vaccines went through that process. And then after these vaccines received an emergency authorization, they actually have followed a number of these patients that were in the clinical trials for months. And there are what we call post-licensure studies. So even after a vaccine is licensed, patients are followed for months to even up to maybe a year or 2 years just to document if there are any long-term side effects. So these vaccines were not developed quicker than any other vaccine. They really went through all the clinical stages.
Terrific. And I think that continued monitoring is important because that's one of the reasons we now know that you may need booster doses, or that you do need booster doses. And if there weren't such studies, we wouldn't know that. There was a question from one of the parents noting that her child had one of those rare side effects. So how safe is it for someone with side effects to get the vaccine, for side effects from COVID? So if you had, let's start with the first easier question. If you had COVID, should you still get a shot?
Absolutely, because even though one does develop immunity or protection, some protection after natural infection, it is nowhere near the protection that is induced or that one gets from being vaccinated. And we recommend that anywhere from 2 weeks after your symptoms have completely disappeared from the natural COVID infection, then go ahead and get vaccinated. Start the series, because you want to prevent becoming infected again.
Sure. Now, what if you had MIS-C? Should you wait a little bit longer?
Yes. So of course. Go ahead.
We are recommending children wait a little bit longer after MIS-C because of the treatments we use for actually treating the condition. that makes it so that we cannot give the vaccine within usually about 90 days after receiving IVIG. So we do advise our patients to wait at least 3 months and discuss receiving the COVID vaccine with their pediatrician or their infectious disease specialist who they're following up with after they've been discharged from the hospital.
Thanks. Thanks, Dr. Shaw. And Dr. Feingold, what are you hearing from parents about the vaccines and why they will or won't get their children vaccinated?
Well, I think the first thing to say is that most parents, their hesitation is because they want to do the right thing by their child. And they really want to make an informed decision. And so I think, that's the first point. We recognize that. And some of the concerns have been due to some misinformation about the vaccine. For example, there was concern or people raised the question of fertility and the long-term outcome, sort of consequences of being vaccinated. The data, and I just saw an article published today showing that there's no impact on fertility. So some of the parents are just hesitant because of some of the concerns I think that Dr. Whitley Williams mentioned about that feeling that this was sort of brought to market quickly. I think once they hear that all the appropriate steps were taken, it makes much more sense. And that, if you're in a pandemic, you want vaccines brought to market. I think the key is to understand what parents' fears are and try to address them with the data and the science we have, and to reassure parents that these worldwide millions and millions of children have been vaccinated, and there's no concern. The safety looks to be very broad, and to try to deal with some of the misinformation with facts and science, while acknowledging that it is often scary to vaccinate your child.
Yeah, I think we know that parents are different. The questions one parent has are not questions that other parents have. So probably the most important thing we can do is just what you said. Ask them, what are your concerns? What are you worried about? And then try to address all of those concerns head on. And I agree with you. I think the misinformation is incredible and far reaching, and you don't know which misinformation has gotten to which person. Dr. Shaw, are you hearing different things from your patients?
I hear sort of the same things that we've addressed. Is this vaccine safe? How do I know I can give this vaccine to my child, not knowing what's going to happen in 10 years and 20 years? And were these vaccines rushed? And so, we've kind of talked about some of those things. I think in terms of knowing what's going to happen in 10 or 20 years, of course, no one's going to have that information. But we also know that the mechanism by which this vaccine works, it's not like the mRNA hangs around in the body. The mRNA is disposed of. And so, there's no reason to believe that if the child does well in the first few weeks after receiving the vaccine, then they're going to have any long-term side effects decades later.
Thanks. Andrea, you have a young child at home. What kinds of things have you been worried about or talking to your pediatrician about?
As any parent, and you said it's very scary, but I think to me, more scary is what would have happened or how my child was going to react if he got COVID. And actually he did. And, because he's too young still to get the vaccine, he was reinfected. And just not knowing how he was going to react, how his body was going to react was really, I think, more scarier to me than knowing that he's vaccinated. We, as a parent, we go in, we got all his scheduled vaccines. We know he's protected against polio and many of these other diseases that we haven't seen in our lifetime because of the effects and the benefits of the vaccine. So to me was more the question of how was he going to react, what was going to be his immune response to the disease. And luckily, he presented a very mild case both times. So But I know that was not the case. And being so close to looking at the numbers and it was hospitalizations, I knew it was like almost like a 50-50 chance. So that was more scary than, getting him vaccinated and knowing that he's protected.
Fantastic. Dr. Whitley Williams, are you hearing any other things or other concerns?
No, I think those are the main things, although people always question what's in the vaccine other than the active ingredients. I know there was some concern about polyethylene glycol and polysorbate. And if a child truly has an allergy to one of those, obviously we recommend that we refer you to an allergist to discern that. Or if someone has a very serious reaction to a COVID-19 vaccine, we refer them to make sure that they're clear. But I can tell you the true contraindication is actually anaphylaxis. So there are some situations where a child can continue with their vaccination series, but obviously after an evaluation by an allergist. But these ingredients are inactive, Meg. They're inactive ingredients, and we should emphasize that these vaccines do not have the preservatives that parents often are worried about, the aluminum and the other preservatives, the aerosol and so forth. These are free of those preservatives. So these are inactive ingredients when we talk about PEG and polysorbate.
Thanks.
I think, Meg, I just wanted, for those of us who've been taking care of children over the past 2 years, both in the hospital and out of the hospital, the serious illnesses that we've seen have been acute COVID, respiratory failure, patients in the ICU, and severe MIS-C. And, I haven't seen any child with severe vaccine reaction or problems with the vaccine. So, from our point of view as physicians who take care of the sick children, what we hope is that people will choose to protect their children from these very serious potential outcomes.
Fantastic. I'm going to just throw this out to all of you. What kinds of protections should parents be giving their children while they're waiting for them to be immunized? So those little ones, 6 months, a year, 2 years, how can a family protect them? Dr. Shaw, you want to start?
Yeah, defer to the parents in the group.
So I have a child in that age group who is not eligible for the vaccine at this time. And my personal and our family's personal strategy has been to try to protect her in the ways that we protect her from other viruses like the flu. So we try to get ourselves immunized so that we are, hopefully not getting the disease, or if we do, we get a mild case of it. We do common sense things, good hand washing. We've taught her good hand washing techniques. We try to limit her social exposures to where we know things will be relatively safe. My priority as a parent is having my child in full-time in-person school. And so, are we able to put her in an environment where we think that that's going to be a safe environment for her? We've kind of normalized masking so that if we are in a place where I think she's vulnerable, she's more than capable and able to wear a mask. So those are some of the things that we have done.
Excellent. What else should we be doing? Anything else, Dr. Feingold?
Well, I think I'm sure Dr. Shaw and Dr. Mejia have been doing this, but avoiding large crowded places where restaurants where people are unmasked and where you don't know the vaccine status of many people, that this is probably not the time to take your child to those situations until things are safer.
Yep. And then something that we didn't do so well in the past, but if you're sick, stay home. Don't go to school, don't go to childcare, don't go to work. It's really not worth exposing other people. So I think, I hope that's something that will last after we get out of this pandemic, that we will be a little more thoughtful about not exposing our our friends and neighbors to all the diseases that we get every now and then. So
Dr.
we have-
Fisher,
yes.
Dr. Fisher, I love what Dr. Shaw talked about in terms of protecting the infant or the children who are too young to be vaccinated. So you well know this about cocooning and making sure everyone in the household who is eligible to be vaccinated is vaccinated, because that does protect the child. I think that's so important, and COVID-19 vaccines as well as flu, as you mentioned. So think about protecting that child by your getting vaccinated. I make that point because many of the admissions that we've had recently, if the children who are being admitted with COVID, who are sick enough to be admitted with COVID, if you ask their parents, are they vaccinated? 9 times out of 10, they are not vaccinated.
And Dr. Williams, to add to that, we might mention here that getting vaccinated while you're pregnant, if you're pregnant, is a way to protect your unborn child. And we're just discussing vaccinating when you're breastfeeding, if that's when you're eligible for vaccine, is another way to protect a young infant. So
Now, there's a question from the audience about the proposal to use Pfizer vaccine for children 6 months to 4 years. How close are we, Dr. Whitley Williams?
Well, I know the ACIP is waiting to meet as soon as this is approved. We anticipate within a week or weeks. So we are very, very close. And again, the clinical trials data does show that it is very safe and tolerated. This will, undergo a strict review by the FDA and the advisory committee to the FDA before it is passed on to the advisory committee on immunization practices. But we're very close, right, Dr. Fisher?
Yep. So next week, the advisory committee to the FDA is going to meet and talk about whether the authorization should be given. And then the week after that, the advisory committee to the CDC will meet. So we're pretty sure we'll have something by the end of the month. So get ready for the opportunity to protect those younger children. It truly is right around the corner. Well, we also got a question about boosters. So if someone was immunized early and they're now a little bit later, can you just sort of give us a little bit, Dr. Feingold, give us a little bit of what the schedule is for boosters?
After the primary series, then we wait generally some months, 5 months or so before, and then we are boosting at this time with 1 additional vaccine. So for most people, that's a 3-dose regimen. So and that may change as we get more and more data. And for some patients who may have received already 3 doses, that their immune systems aren't quite as strong due to some underlying condition, we consider their primary series either 3 doses, and some of those patients are being recommended now to boost with a 4th dose. But for most healthy children, the booster is a 3rd dose after the first 2 in the series.
And again, remember, for children, it's Pfizer only. For the adults, there is a choice. You can get either Pfizer or Moderna. Or J&J, although the Pfizer and Moderna are the preferred vaccines for the boosting, and actually also for the primary series. There's a question about how effective is the vaccine between the ages of 5 and 11, and how long does that protection last? You want to take that one, Dr. Williams, Whitley Williams?
Yes. So thank you. So the vaccine, we know that the effectiveness does last for months. We're not sure. It may be that they are going to require a booster as well. I think it's going to depend where we are in the country in terms of the number of cases and how prevalent and what variant may be circulating. So there's no current recommendation for booster, obviously. But as far as we know, remember, those clinical trials have been ongoing for maybe about 9 months, I believe, or even longer. So we will have data in terms of how long their antibody levels, their protection does persist. But at this moment, we don't have data enough to say they're going to require a booster. It looks like it's probably about 91%, I believe, effective in preventing hospitalization and deaths. So it looks it looks like a wonderful vaccine. And again, we were one of the sites that participated in the clinical trials. And again, I have to say it was well tolerated. I can't tell you how important this is, because in the first wave and a year ago, we didn't see a lot of children under a year of age. This time, maybe because of the Omicron variant, we did see children under a year of age being hospitalized with pneumonitis, some bronchiolitis, and so forth. So this is very important to immunize that younger age group.
I think
Yeah.
one other, oh, sorry, Meg. I would add that, people will hear about and lots of breakthrough infections, and that is certainly happening. So this is one of those vaccines that doesn't prevent all infection, but it's very clear that that patients who are immunized, especially fully immunized with both doses plus a booster, have much, much lower rates of hospitalization and death. So, and that's true for the children as well. So that even though you'll hear people talk about, I had the vaccine, but I got COVID anyway. So we know that it doesn't eliminate all infection, but serious infections are markedly reduced.
Yeah, we do keep track of that information here at the Department of Health, and we've been looking at the children who have been hospitalized over the last several months. And I would say 95% of them have not received a vaccine. So it's very unusual that a vaccinated child is hospitalized. But breakthrough cases, for sure. Breakthrough cases occur after the vaccine. And as you've heard, it even with natural immunity, you can get a second case of the disease. So all the more reason to ensure that you get those vaccines and go ahead and get boosted.
I think sometimes people think that if there are breakthrough infections, the vaccine's not working. And that's really not what we're trying to do, is protect life-threatening illness or hospitalization. We know that we can't eliminate all illness. Very similar to the flu vaccine.
Yep. Although I think it may be even a little better than the flu vaccine.
Yes.
Dr. Shaw, where can I go to get my child vaccinated? Can I just go to my pediatrician? Do I have to go somewhere else? Who's got that vaccine?
I think that's a really important question, because especially if you are on the fence of whether you want to get this vaccine for your child or not, a great resource is your pediatrician. That is someone who knows your family, knows your child, and knows the science and the data. And so most pediatricians are trying to, if not offering the vaccine in their own practice, have great resources of where you can go to get vaccinated. And to get that information from your pediatrician just adds that extra layer of security. There are mega sites all across the state. A lot of hospitals in your region may be offering the vaccine to children 5 and up. And then, of course, your local pharmacy is also offering the vaccine to children ages 5 and up. So there are lots of places to get the vaccine, and there are lots of doses available.
And there certainly are many pediatricians in New Jersey that do have the vaccine, but not all of them are yet able to offer that vaccine. The information on where to get a vaccine is definitely available on the New Jersey Department of Health website. You go to that COVID hub and you just click on the button, where do I get a vaccine? And you put in your zip code and it will tell you where the vaccines are available close to you. If you need transportation, there are a variety of opportunities to get transportation. There's some free rides with Uber. There are the New Jersey Transit has special fares for people who are going to get their vaccine. Some of the local faith-based organizations or community-based organizations have people who will take people in their community to go get the vaccines. So we're really trying very hard to make sure that these vaccines are conveniently available. We also, for the school-age children, we've done now over 700 school-based or school-affiliated clinics. And we know that schools are very good at giving vaccines. They've had school-based influenza clinics for years and years. They're very successful. It's a safe place for children. Children are comfortable in that setting, and many parents are comfortable having their children vaccinated in that setting. So I think that's another thing to check out to see if one of the schools near you, if they're offering the vaccines, that's another way that you can get for the vaccine. Dr. Shaw, are you finding vaccine hesitancy in any particular communities or among any particular communities? And then I'm going to ask that of our other panelists as well.
I think, like we've been discussing as parents, sort of across the board, people are not sure about the vaccine. There was the first wave of parents who had lined up the day it came out to be able to get their children this vaccine. And then there's the camp that says, you know what, I'm not sure I want to get this vaccine for my child. But a lot of the hesitancy is really across the board. And I'm hopeful that, with increased education on some of these fears, we can sort of move the number towards getting children vaccinated if appropriate.
And Dr. Whitley Williams, we've heard a lot about communities of color and hesitancy among them. What are you finding?
Yes, so that is definitely a factor in terms of increasing the coverage rates in communities of color. It is of great concern because persons of color are disproportionately affected. It's true even if you look at the children who are becoming sick. And again, it's because if their families are not vaccinated, then the children are at increased risk as well. I think having that discussion with parents, trying to dismay and also talk about some of the myths that we hear, particularly about sterility, and pointing out that there is science that says no, that this does not affect fertility, does not affect sterility in the males. So we continue to work, but there have been some wonderful models where communities using community health workers, so they look like the people in the community, they have been able to either going door by door or going to certain community fairs. They've been able to increase the coverage rates actually in certain communities, like New Brunswick and Patterson. They've had some very successful, and they were supported definitely by the New Jersey Department of Health, which has excellent initiatives trying to increase coverage rates in communities of color. Some of that is due to the hesitancy, as you probably are aware, is due to the past history, I think, of structural racism, of distrust in the medical community. One of the things also that has helped is to make sure that physicians who practice in communities of color are also very much aware of the safety profile of these vaccines and very much aware of the research that dispels some of the myths. So that's been important because people listen, some people do listen to their physicians. And so it's very important that that message gets out to the community by a person who looks like them and may even live in the community as well. But that's an ongoing challenge, but I think we are doing better in certainly in some areas by the use of community health workers and outreach.
Good. I know language can be a barrier, and I know that I think Andrea, you participated in a Facebook Live event that was all in Spanish, and tell us a little bit about that.
Yeah, that's correct. I mean, with the concerns that communities have across the board, and obviously a little particularly more challenging for communities who English might not be their first language, and it's always very important to communicate with the community in the language that they speak and where they're comfortable, that they feel, and especially people that look like them, like Dr. Williams mentioned. So in the Department of Health, we not only have make sure that our center, like our call center, has like people that speak Spanish. We have agents that speak Spanish. We also have a community corps who's out there doing a lot of the outreach, and they also speak Spanish. But we're also participating with different community groups in their Facebook Lives. We're answering questions. We have done a lot of, we have talked to Telemundo, Univision. We have done some radio as well. Disseminating the information, educating our community, but also demystifying some other stuff that is being said, all that misinformation that has also translated into other languages. So it's been a multicultural, multilingual approach that we have taken here at the department. And anytime we, have the opportunity to speak with somebody in our own language, in their native language, is very important.
Thanks.
I think one thing that Dr. Whitley Williams mentioned is sometimes you have to start with the parents. So often in these families where the child is not vaccinated or they're very reluctant, they haven't themselves been vaccinated. So, sometimes the discussion from even the pediatrician has to start with the parents. What are their fears? What are their concerns? Why have they not considered vaccination? And then move on to, once you can move that needle, maybe you can start talking about the child, because it tends to, they tend to align. It's rare for parents to vaccinate their children who themselves have not been vaccinated. So, sort of talking in terms of protecting the whole family, and many of these families have lost members to COVID. And so, trying to sort of make the point that there is a way to prevent further loss and tragedy is important.
Yeah.
And the other thing that I also find very important, I find out most and a couple of folks that I speak within the Spanish community, is the parents are willing to get vaccinated, but not their kids. They're really afraid for the kids. So we have a lot of parents that have said, I'm boosted, I have my book, but they're really concerned, they're really scared of vaccinating their kids. So I think it's important to educate those parents as well, because they're willing to do that for themselves, but they're really very, very hesitant about their kids.
Yep. And again, it's important to find out exactly what the hesitation is and address that as well as you can. There's a question, Dr. Feingold, about if a child completed the 2 doses of primary immunization and got infected recently, before he or she was due for the booster, and they have a robust T-cell immunity and high antibody titers, is it still necessary to take the booster shot? And if yes, why? And you might also mention that we don't usually test T-cell function specific, but take it away.
Well, I think it's a very good question and a very high level of thinking. I'm very impressed. I think what we don't really know what correlates with complete protection vis-a-vis natural infection, and we don't know how long lasting that immunity is. So even though it looks like certainly getting infected and not getting very ill, but surviving that infection definitely boosts your immunity. But I think all the data is pointing towards that the best thing to do is to boost on top of natural infection. Whenever you get your natural infection, if you get it, anytime during the vaccine series and before the booster, that all you're going to do by boosting is increase your titers even more, and so and potentially much longer lasting. So the science at this point, the recommendation is clearly to vaccinate anywhere in the series, even if you have intercurrent COVID.
Terrific. There's one more question, Dr. Whitley Williams. How will the vaccine fit into a baby's vaccine schedule?
Oh, that's a great question. One of the things that they do look at in the clinical trials is, because remember, these children are of age and clinical trials do not delay their routinely recommended childhood vaccinations. So they do look at the simultaneously administered vaccination. So they do look, okay, they got COVID COVID-19 vaccine, and at the same time, they were due for their Prevnar. So they do look at that and make sure you still get the same response from in response to getting the Prevnar vaccine, but also that you also get a good response to the COVID-19. So they look to make sure that one doesn't block the response of the other. So that information will be reviewed definitely both by the FDA and certainly by the advisory committee before recommendations are made. So there should be no disruption or no delay or missed opportunities due to the COVID-19 vaccine.
So I think we now know, you, just as you said, you can give the vaccines together. So if someone needs a flu shot and they also need this shot, give them at the same time.
They can
get it over with, use every opportunity. So I see we're coming up, believe it or not, we are almost at the end of the hour. There is a comment from the audience. From previous experience, Hispanic communities are often afraid of being singled out by the government. They're afraid of deportation and racism, and you really can't blame them. There should be a way to work with communities to make everyone feel at ease. And I think here at the health department, one of the things we've seen is that the Hispanic communities have not been vaccine hesitant. They just need the vaccines to be made convenient so they can get to them. If you're working all day and and the vaccine clinics end at 5 o'clock, that's not convenient. So I think we're really trying hard to ensure that they're more convenient. Do you have any comments, Andrea?
Yeah, no, that's correct. Dr. Fisher, what we find out, and that the community has been looking for the vaccine. They want to get vaccinated. For the most part, the response to the vaccine has been great. Accessibility is obviously very important, but also going into places that they're comfortable. You're right. There's a lot of hesitancy in the Latino community, particularly when it comes to government agencies. So we have partnered with different community groups. We have held vaccination clinics at churches and places where they're comfortable with, where they know that they're familiar with, that faces that they know. So that has alleviated a lot of this fear of encountering a government agency that might not be, a friendly face for them. But you're right, what we have seen so far, and I think the numbers indicate that, right? Like with 23% of the population in New Jersey is of Hispanic descent, and we have vaccinated 17% of them. So the number is really good. And, we still have a lot of work to do. Still, we want to get to the, 23%. But we can see that it wasn't much hesitancy as accessibility and partnering with the right groups that can grieve, and the information, the education, having our people out there in the community giving the information in their language, really, I think, alleviate a lot of those fears.
Thank you. That's perfect. I'm going to give our other panelists just a minute to give one last word of advice to the parents who are listening. Dr. Feingold?
That as pediatricians, as a hospitalist, as pediatric infectious disease specialists, as health department staff, we have nothing but your child's best safety and health in mind. And we strongly recommend this vaccine and believe in it, and want to be there to offer any advice and answer any questions anybody has, so that we can, protect our children and get life back to normal for them.
Thanks. Dr. Shaw?
This is a really difficult time to be a parent, and this is a really difficult time to have social media, because so many things are on social media and it's hard to weed through what's true and what isn't. And so I want to thank the parents who have chosen to listen to our session today, and just acknowledge how difficult of a time this is. And remember to use your pediatrician as a resource for you and your family moving forward, because like Dr. Feingold said, we all have your child's best interest at heart.
Thank you. And Dr. Whitley Williams?
Yes, thank you. I would just like to say, first of all, congratulate those parents and children who have been vaccinated to date, to have the courage and the wisdom, I think, to go and get vaccinated. I think for those who are still sitting on the fence or not quite sure I would just like to emphasize that the vaccines are safe. And I can tell you that the risk, any risks from the vaccine, the benefits from the vaccine certainly far outweigh the risk. And as clinicians, we can tell you that it's devastating to see the children come in with infected with COVID, whether they have pneumonia or the MISC. It is just devastating to see them on ventilators. So if they are of age to be vaccinated, please get them vaccinated. If they're not, obviously do all the things that we talked about during the past hour and make sure everybody in your household who's age eligible to be vaccinated, please get vaccinated.
Thanks so much. I just want to thank my panelists tonight and also thank all of you who are listening in. This was recorded and will be available, and we hope that this information has been useful for all of you. So thanks again. Please stay safe, keep your children safe, and be well.